Alright, my name's Alex Michaeletti, and today I'm going to be teaching you guys about the nursing management of Clostridium difficile infection. What is Clostridium difficile? We're going to call it C. diff for the rest of the video. Clostridium difficile infection is a severe infection of the colon, often happening after normal gut flora is eradicated by the use of antibiotics. So basically you take an antibiotic and you have good bacteria in your body that actually helps you out, and when you take these, it gets rid of that, and then bad bacteria, C. diff, comes in and makes you sick. Risk factors associated with C. diff: antibiotic use, like we just talked about, gastrointestinal surgery, diseases of the colon such as inflammatory bowel disease or colorectal cancer, and compromised immune systems like AIDS patients and cancer patients that are taking chemotherapy. Signs and symptoms of C. diff: watery diarrhea up to 15 times each day, severe abdominal pain, loss of appetite, fever, blood or pus in the stool, and weight loss. Diagnosis of C. diff: stool test, enzyme immunoassay, a colon examination, and imaging tests like a abdominal x-ray or a CT scan. So the treatment and management of C. diff: you take antibiotics such as metronidazole, which is Flagyl, vancomycin, vancomycin, and fidaxomicin, difficile. These have all been known to successfully treat C. diff. So even though you took a antibiotic and it made you sick and got C. diff, you would still treat C. diff with more antibiotics. More treatment: you can do a fecal microbiota transplant, which is a stool transplant, using a nasogastric tube, NG tube, or a colonoscope. And these have been known to have up to a 90% success rate for treating C. diff. And what this is you'll get an appropriate donor, get a stool sample from them, and they'll insert that into your colon to help replace those good bacteria that you lost. And in the most severe cases, they'll do surgery to remove the diseased portion of the colon. The transmission of C. diff. C. diff is transmitted by fecal-oral routes. So if you have a patient with this, you're going to do contact precautions. You're going to gown up, you're going to put on gloves, and if you have to clean up like some explosive watery diarrhea, you'll wear a mask as well. To prevent C. diff, the most important way to do this is to do hand hygiene. And to this, you're going to wet your hands real good, you're going to put on liquid soap, and you're going to lather and scrub for up to 20 seconds or longer. Make sure you get between your fingers and under your nails and all that. And you want to rinse the soap and everything off for at least 10 seconds, and you're going to dry your hands. More prevention: limit the amount of visitors if possible. I know if you're on the floor and you have a bunch of family coming by, this can be hard to do. But if you feel like your patient is at risk, just try your best. You want to clean the rooms with hospital-grade disinfectant, whatever the hospital policy is, or use chlorine bleach. Avoid unnecessary antibiotic use, as we talked about earlier. Ask all the healthcare providers to clean their stethoscopes and whatever equipment they're using on your patient before they actually touch your patient with it. And when in doubt, clean, clean, clean. Thermometers, phones, just anything that you are afraid may be contaminated. Alright, and I got a cool little video for you guys to check out.
This is CDOG-MD. We've unleashed a monster. It's everywhere, and it's coming. It's coming. No, no! You go to the doctor to talk them into giving antibiotics for your cough and things. They explain that the pain in your throat's a virus.
Antibiotics are not desirous.
But you ain't hearing this. You get all in their face.
Boy, this is malpractice, a total disgrace.
I'm not leaving this place without a script, my man. Frustrated and berated, Doc throws up his hands. Max pill on your tongue. Protect the bugs in your gut, killed off, son. Your belly ain't feeling so great, and runny diarrhea straight ruins your days.
Fee, fi, fo, fum.
I smell the stench of Clostridium. Difficile colitis serves uritis. But wasted antibiotics on a virus. Now C. diff's free to grow, no competition. The spores that it sows fecal oral transmission. In the ED, you'll marinate. Now you see diff straight disseminate. Yo, now they say you'll run down the middle type runs, cause the C. diff germs ain't fun. They're the ones with the toxins, fever, septic shock, and toxic megacolon. Yo, and the spores that they shed in the hospital bed, they dead with Purell gel. What the hell? Use contact precautions, hand washings, hospital personnel. Yo, dog MP, just keeping it real. With some loose spelling rhymes and an old school feel. Zombies creeping like Dawn of the Dead. C. diff sipping and spawning to spread. Use antibiotics as intended. And wash your hands now, docs, like you meant it. If you don't buy my advice, at least rent it. Hot mess in your shorts, prevented.
And like he was saying again, just making sure you use antibiotics appropriately. And if you don't have to use them, don't use them, because you don't want your patient to get something like C. diff. Alright, now I got a post-test for you guys. You guys feel like you have a pretty good understanding of C. diff now?
Yep.
Okay, well, let's see how y'all can do on this. Just give you all a minute to get that done. Everybody finished?
Yep.
Okay, let's go over it then. Alright, number one. You may get C. diff infection if you take antibiotics. True or false? What do you guys think?
True.
True. Good job. Clostridium difficile are bacteria that can cause swelling and irritation of the large intestine or colon. This inflammation, known as colitis, can cause all of the following except A. Diarrhea, B. Fever, C. Abdominal cramps, or D. Hearing loss. What you guys think?
D.
Correct again. C. difficile is most common in people who are taking antibiotics while in the hospital. It is especially common in older adults in hospitals and nursing homes. True or false?
True.
Good job. Your doctor will treat C. difficile colitis with antibiotics other than the one that caused the infection. You will likely take vancomycin or metronidazole, which is Flagyl, by mouth. A. True. B. False. What you think?
True.
Okay. Alright. Last one. In rare cases, a person who is very ill from C. difficile may develop a hole or perforation in the intestine. A perforation is not considered a medical emergency and does not require surgery. A. True or B. False?
False.
Alright. Good job, guys. Seems like you have a well understanding of C. diff now. And I have one more paper I'm going to hand out to y'all. It's just a more in-depth about the actual patho of the disease. But just read that on your own time if you want to know a little more, and that should do it. Thanks.